Hi, it's Dr. Parkeh from Austin Family Allergy and Asthma, and today I want to talk about spring allergies, which is what I think of as the prototype allergies for most people. Often for people who are getting allergies for the first time, it starts in the spring, and for people who already have allergies, they love spring because of the warm weather, but man, they also dread it because of the symptoms they experience. So the major symptoms we'll see will start right with the eyes: itchy, red, watery eyes. If you keep rubbing them too much, be careful, you might get a secondary infection with that. In terms of nose, that's the most biggest, is constant itch, sneezing, and even if you're indoors, even just sometimes walking from your house to the car is enough to set it off. And a lot of congestion, sometimes alternating with the runny nose and sneezing. Sometimes when there's postnasal drip and it goes into the back of the throat, it's kind of just an itch sensation in the back of the throat that you can't get rid of, even if you drink ice water or if you try to clear your throat. Sometimes what happens is it kind of referred into the ear and you feel like this itching sensation in your ear, and it's just terrible for our patients who are experiencing it because they really experience it very severely. It's not just a nuisance, but it's a major thing that affects their day-to-day functioning when they're at work or at meetings or something like that. So that is spring allergies. And when we think of, well, what can we do, certainly you got to go outside and enjoy the warm weather. I think avoidance is not practical, but the best treatment we have is to target the underlying cause in the inflammation, and that's called immunotherapy, and we do that by drops or by injection method, and that primes your immune system to not essentially freak out when it sees the allergies, and that's the best treatment. And then, of course, the other thing people often do, especially before they come see us, they try it for sometimes years, is all of the over-the-counter medicines, which essentially are like Band-Aids, but they're not solving the underlying problem. And these antihistamine pills or your Claritins or your nasal sprays or your eye drops. If you have really, really mild allergies, that might suffice, but for most people with really bad spring allergies, you need the best treatment that we have to offer. So good luck to you this spring, and I hope you enjoy it.